First of all, I'll just give you a sense of some of the research that we've been doing in London over the last 6 years or so. Started with a psilocybin ASL study, so that was an fMRI study looking at how psilocybin changes brain blood flow. We went on and did a bold fMRI study that allowed us to look at some brain network properties, things like these changes in the default mode network. After that, we went on and used a complementary brain imaging modality, MEG, which allows us to look at brain activity with a finer temporal resolution. We also did an fMRI study with MDMA, interesting project funded partly by television. And most recently, we completed quite a comprehensive brain imaging study with LSD, using both fMRI and MEG within the same sessions. And even more recently, we've just finished the first phase of a psilocybin for depression, treatment-resistant depression, clinical trial. So I told you about ASL, this measure of brain blood flow. Those maps, blue, indicating regions in the brain where there were decreases in blood flow. Now, the important thing with this result now that we've seen more data with LSD is the location of the changes. So you'll note that there are changes in the center of the brain, that's the thalamus, and also in certain cortical regions, the outside of the brain. Now, what's important is that these regions are hub structures in the brain. They're regions where there's particularly dense connectivity. There are also regions in the brain that are especially metabolically hungry and metabolically active. So they're important kind of hub centers, kind of capital cities, if you want, in the brain. And we see an alteration, a change in the function, a change in the activity in those regions. So if we move over to the top right corner, you can see these are our bold results. These are looking at change in brain networks now. And what we did with this analysis, we looked at a particular brain network, the default mode network. You can see it in orange. And you can see the top row there. That's what the default mode network's normally like. That's what your brains, unless you're on psychedelics, would be like now, with activity correlated in the orange regions to the region in red. We call that a seed region. Now, the important finding here is the row below. And you can see the regions that are normally positively coupled to the seed region become decoupled. We're seeing a kind of disintegration within this particular network. And this network's called the default mode network. This is what we call a correlation matrix. Essentially, all these different squares within this broader square, correlation strengths between different pairs of network. The more intense the red, the stronger is the correlation between these networks. Now, ordinarily, the brain has a number of different brain networks, and they have quite a high degree of segregation between them. They're orthogonal, meaning they're not correlated, and they need to be not correlated because otherwise they wouldn't be distinct from each other. So this property of segregation is something that we see in the brain. What we see with psychedelics is what could be described as a desegregation. So the distinction between brain networks becomes decreased under psychedelics, and we saw that with psilocybin. This was our MEG result. We're looking at a range of different oscillatory frequencies or rhythms within the brain, and MEG allows us to look at a broad range of temporal frequency bands. And the main take-home message with this result was that we saw a broadband decrease in oscillatory power within the brain. So to say that another way, a slightly more intuitive and accessible way, we saw a collapse really in the normal rhythmicity of activity within the brain. Now, what was interesting is, again, where we saw the spatial localization of those effects, and they were in consistent regions to where we'd seen changes in brain activity with the fMRI. So more specifically, we saw decreases in regions that belong to this default mode network, and we saw decreases in a particular frequency band, the alpha frequency, which we know is a very dominant rhythm within brains, and particularly human brains, and particularly adult human brains. We extracted the signal from the posterior cingulate cortex, a region of the default mode network, within the alpha range, and we looked at the magnitude of the collapse in that particular rhythm. And then we plotted that against our participants' ratings of different psychological or subjective aspects of their experiences. Now, we saw a very strong correlation between the magnitude of the collapse in the alpha frequency, the oscillations in the alpha frequency within this posterior cingulate cortex region, and people's ratings of ego dissolution. And it was a stronger relationship with this ego dissolution rating than any of the other psychological ratings. And when we did something which is good practice in science, we corrected for making multiple tests, this correlation still survived. So we say it survives correction for multiple comparisons. What we're showing here is the communication patterns within the brain. You can see different colors there. Those are communities of brain regions. Ordinarily, the communication patterns are relatively restricted or confined to within particular communities. You could think about people communicating within particular countries, for example. Most of the communication is within the country, under placebo, under baseline conditions. What you can see with psilocybin is that there's really quite a profound increase in the crosstalk between different regions and different communities of regions within the brain. You could summarize this as sort of indicative of an increase in global flexibility, a kind of more unified, if you want, mode of functioning in the brain under psilocybin. And then we have things, our participants describing their experiences in ways such as this. One volunteer saying that there was a definite sense of lubrication, of freedom, of the cogs being loosened and firing off into all sorts of unexpected directions. So this general rule of increased flexibility within the brain and within the mind seems to stand up with psychedelics. In summary, the design of our LSD brain imaging work is as follows. We gave the LSD intravenously to 20 healthy psychedelic experienced volunteers, 16 males, 4 females, average age of 31. They're scanned twice, 2 weeks apart in a balanced order, half of them getting LSD first and half of them getting it in their second scan. The dose of LSD was 75 micrograms given intravenously. It's comparable to about more or less 100 mics taken orally. So we inject the drug over 2 minutes. 60 minutes before they go into the MRI scan, we do quite a lengthy fMRI session of about 60, 70 minutes. There's a relatively short break of around 30 minutes when we set them up for the MEG, and then they go into the MEG scanner for about 70 minutes again. So quite a demanding design for the participants, but more or less all of them tolerated it well. So some key principles that have come out of the LSD data and very consistent with what we've seen with psilocybin are changes in 2 particular properties within the brain. One of them is integration and one of them is segregation. Integration is referring to how different regions, different nodes if you want, that constitute and comprise a particular system or network, how strongly their activity is correlated. So that tells us how well integrated the bits that comprise a system are. You can see 2 signals there. This is the activity that we record with fMRI. You can see the natural fluctuations here, the activity going up and down. You might be able to see there's 2 colors. Those are signals from 2 different regions, and you can probably see that the activity is very well correlated. Essentially, that's telling us that there's good integration within this particular system, and it's the motor system within the brain. So segregation is how different systems or different regions that belong to different systems, how their activity is orthogonal, how it's not correlated. And this tells us that those systems are separate, they're segregated from each other. And you can see that here if you look at the activity in these 2 different systems. One from the motor system here in orange, and this is pink, and this is the visual system. These are different systems, they do different things, and their activity is segregated, it's orthogonal, it's not correlated. We looked at the level of integrity of a range of different brain networks, and we also plotted those changes in relation to the psychological effects. Now, what we found was that there was really quite a universal effect on brain networks. There was a decrease in the integrity of a range of different networks. We saw that in this well-known default mode network, and what we found, which was interesting, was that the magnitude of that disintegration within the default mode network correlated significantly with people's ratings of ego dissolution again. Now, this was a specific relationship as well. It was selective just for that default mode network. So when we looked at relationship with ego dissolution and, say, the visual network, we didn't see that significant relationship. So there's something important about the default mode network and its disintegration and people's experiences of ego dissolution under psychedelics. Normally, the parahippocampus it talks a lot with regions, cortical regions of the default mode network. Now, what we saw under LSD, which is important, we saw a very strong relationship between the magnitude of the decoupling or the disconnection between the parahippocampal activity and an important kind of posterior cingulate cortex region of the default mode network. Again, this is quite difficult for you, but nevertheless it is important. It's telling us really what circuits are crucial not just for the experience of ego dissolution under psychedelics, but by using psychedelics as tools to understand the brain and understand consciousness. Really, it's telling us something about the circuitry that underlies our sense of self in general, which I think is a more profound and important matter, really. But just to give you a flavor of the kind of things people describe in relation to ego dissolution, we have a volunteer on LSD here saying, I felt removed in some way from what I'd usually describe as myself. Another one saying that was real ego death stuff. I only existed as a concept, as an idea. And you can see the rating scale that we actually gave people. After each scan, I experienced a dissolving of myself or ego. What does it mean? Well, we're trying to develop an actual ego dissolution inventory that hopefully other researchers will adopt when studying psychedelics and maybe other states, like maybe psychosis-related states. One way we've tried to tackle this is to look at the kind of language that people use when they're under the influence of psychedelics. And these personal pronouns like I, me, or mine, these kind of possessive pronouns seem to be very much related to what we mean by the sense of ego. To put that in a bit of context, there was a very interesting study published in Science in 2010, which looked at the rate or the prevalence of daydreaming. They use a technique called experience sampling, which sort of randomly prompts you to report what you're thinking about, and actually, in this case, your well-being as well, how happy you are generally. And they actually found that the more often people were outside of the moment, the more often they were daydreaming and not present, the more likely they were to report negative mood. And the more present they were, the more likely they were to report positive mood. And this is quite consistent with the kind of principles of mindfulness of certain Eastern philosophies that promote being present, being in the here and now. Now, interestingly, in the context of depression, if you look at this default mode network that I keep talking about, and eventually I will explain what we think it is. If you haven't guessed, we think it is a network that relates to the sense of self or ego. And if you look within this default mode network and its the tightness of its connectivity in depression, you see a positive relationship between the tightness and people's ratings of rumination within depression. So the more ruminative they are, the more they're chewing over their problems and how terrible they are and how terrible everything is, the tighter becomes this default mode network. Now this is relevant because, as I said, we looked at the kind of things people were saying under LSD. We did structured interviews shortly after their MRI scan and their MEG scan. When we looked in the MRI data, post-MRI data, when they were feeling the effects most intensely, we found this significant decrease in the prevalence of people to contemplate on themselves in the past. So the less self-reflective in a retrospective direction they were, we found that under LSD. And then when we looked at the relationship of that decrease in reflection on the past and the default mode network, we saw a relationship in the predicted direction, which is the greater the disintegration within the default mode network, the less likely people were to be reflective on themselves in the past. So another way of trying to kind of develop the validity, the construct validity, as we say, of the ego, of ego dissolution and its relationship to the brain. In summary, the key findings with our LSD research have been this disintegration of brain networks and also a desegregation, which is very consistent with what we saw with psilocybin. Networks themselves lose their individual identity, they kind of dissolve, and they kind of meld into one. They become more similar to each other. What's interesting, if you look at the brain normally and how it develops through maturity, you'll see an increase in these properties of integration of brain systems and also their segregation. So the brain kind of refines it. These systems get a very kind of clear identity, and they also gain their identity by parcellating off from each other, from being separate from each other and doing different things. And this process is kind of what defines, it seems, the process of a developing brain, of a maturing brain into adulthood. Now, it's interesting, therefore, that under psychedelics we see the opposite of this. And then it makes sense, I think, to make the inference that what we're seeing is a kind of regression. I mean, it's been talked about a lot. I know Stan Grof talks about regression in the context of psychedelics. So again, it makes sense, this mapping between the psychology of the state and what we're seeing when we look at the brain activity. Some writers, such as William Wordsworth, have been particularly romantic about the nature of infant consciousness. And it's this line that I like: "Heaven lies about us in our infancy." shades of the prison house begin to close upon the growing boy. Essentially, we're seeing something similar when we look at brain activity under psychedelics. We're seeing this kind of dissolution to a kind of more fluid mode of functioning, and we're seeing it with psilocybin, and we're seeing it also with LSD, increased connectivity and communication across the brain. Now, how could this map onto the phenomenology? Well, we've speculated a sense of oneness, which some people have written could be the sort of definitive characteristic of the mystical experience, may relate to the way that the brain becomes more globally connected under psychedelics, that in a way the brain is functioning more as one system rather than being a system with many different systems within it. This kind of collapse between systems that are either normally orthogonal, uncorrelated, or even competitive, having a kind of yin-yang relationship, which may underlie things like subject and object, this differentiation, this dichotomy, that dichotomy seems to collapse under psychedelics. So I've related this to a notion and a measure really borrowed from thermodynamics and also information theory of entropy. What's entropy? Really, it's a measure of the unpredictability of a system. And so it's equivalent in many ways to the level of order or organization of a system. The higher the entropy, the lower the order or organization, the more disordered, the more chaotic. So we've looked at changes in brain entropy under LSD. We've seen the predicted increases in brain entropy. You can see the regions and the networks that are identified here in red. But the real exciting thing is that we've looked at change in personality post-LSD, albeit only 2 weeks post in this case. We saw increases in openness. The magnitude of the increase in brain entropy in the acute state was actually highly predictive of these subsequent increases in openness. So those with the more entropic, the more kind of chaotic brains under LSD, the greater was their increase in personality, in openness. The greater was their change in personality after the experience. Maybe political opinion can be changed by psychedelics. As challenging and as dangerous as that idea is, there is a study which I think is very intriguing that found a very strong relationship and reliable relationship between openness and liberalism. Dangerous idea perhaps, but science is all about asking the questions. I want to tell you about our depression data. Depression is a major public health problem. It affects some 150 million people worldwide. It's the most costly brain disorder in Europe. I'm not sure about the stats in the US. A leading cause of premature death, of course, through suicide, incredibly tragic in many cases. As many as 20% of patients do not respond to any treatment for depression as well, and only 50% will respond to mainstream interventions, the first-line interventions. There's no placebo in this feasibility study, and it's only in 12, but it's treatment-resistant depression, so very severe depression. The patients haven't responded to at least 2 different medications within the current episode. We give them 2 doses of psilocybin. We give a low dose in the first case and a high dose a week later, 25 milligrams. We have a positive setting, of course, with preparation, proper preparation, classical music and appropriate aftercare as well. And we do imaging before and after. I don't have those results. They're a bit too fresh to present. We do have something, but it takes a little while for these things to percolate. But here are our results. This was a key endpoint. We wanted to make the comparison with ketamine, which is another rapid-acting antidepressant. But in the case of ketamine, its effects are short-lived. Here we're just looking at that key endpoint of 1 week post-treatment. You can see that the patients, on average, were in the domain of severe depression at baseline and a massive effect size of 3.2, with the average being in the domain of remission, so no depression, 1 week post-treatment. Of course, there are individual differences, but it's important to see that all responded. We believe that what we're seeing with psilocybin in depression carries much more potential than ketamine, which is heralded as one of the most significant advances in the field of depression in recent years. The effects weren't just restricted to depression, also anxiety. There's also increases in optimism 1 week post-treatment and drops in anhedonia, a particularly difficult symptom to treat in depression, inability to experience pleasure. I just want to read you a brief vignette from one of the patients. He said about his depression in general that for decades he's battled depression, the awful feeling that you don't matter, that you're not making a difference, that everybody else is having a better life, and the utter pointlessness of it all, getting no real enjoyment from anything. He says about the experience that it would be futile to describe the experience in full, given its nature is to be profound and mind-altering. There simply aren't the words to describe some of the experience, but I can say that it felt like the usual self-narration we all have vanished completely. It was replaced by a sense of beautiful chaos, a landscape of unimaginable color and beauty. It was as if daily reality was entirely fake, a bizarre dream, and what I was experiencing now was the real thing. I began to see that all of my concerns about daily living weren't relevant, that they were a result of a spiral into the inconsequential. I also felt that I was learning without being taught, that inner healer perhaps. That intuition was being fed. Fleeting feelings from my past came back, memories too, both of which seemed long forgotten. And about the outcome, he said, although it's early days yet, the results are amazing. I feel more confident and calm than I have in such a long time. My outlook has changed significantly too. I'm more aware now that it's pointless to get wrapped up in endless negativity. I feel as if I've seen a much clearer picture of which this life is just a tiny part. So it seems ludicrous to worry so much about it. Another side to this is I feel like I've had a second chance, like a survivor, someone who wants to live for the day, for the experience. I feel like I can enjoy things the way I used to, without the cynicism, without the oppression. At its most basic, I feel like I used to before the depression. Just to end, I'd like to thank David Nutt, who really allowed me to do this research, and similarly Amanda Fielding of the Beckley Foundation, who's been provided consistent support throughout, the Medical Research Council, who funded the depression trial. Hopefully they'll fund us into the future, although it's a bit touch and go. And the crowdfunding campaign, if any of you supported that, thank you very much, because that allowed us to complete the LSD study. And thank you very much for your attention. Some people would talk about DMT, the fact that it's found in the body. Unfortunately, there is a kind of knowledge gap around how much DMT there is in the brain, whether that could be responsible for these experiences, whether it's released in higher concentrations in certain states. Perhaps a more sober, perhaps more plausible explanation is that serotonin, if released in high concentrations, could begin to have psychedelic effects itself. I mean, of course, these receptors are there. They're there for a reason. Some people might speculate that they're there for an endogenous psychedelic to hit. But they could be there for serotonin, but they could be there for serotonin if serotonin is released in special circumstances, and perhaps special circumstances which demand some kind of profound behavioral or psychological change. And fitting with that idea, serotonin release is greatly elevated during states of arousal and particularly stress. So if in a situation of extreme stress, you would have an increase in serotonin release, and then it may reach the kind of critical levels required to hit sufficient serotonin 2A receptors, and then to allow the kind of flexibility of brain and mind and the conditions for plasticity to engender some kind of lasting change. It's difficult to know if it's something that people bring to the experience. We certainly don't direct people in the direction of having a mystical experience, but sometimes it just happens spontaneously. I mean, sometimes it's difficult to know if it's people who have a particularly spiritual or religious background who are more likely to simply just use that language. I think that's one of the reasons that we concentrate on ego dissolution, because if you look at how the mystical experience has been discussed by people like William James and Walter Stace, so scholars of the mystical experience, and they look for kind of common denominators or sort of key characteristics of the mystical experience. They all seem to sort of focus in on ego dissolution and the accompanying sense of oneness. So although again it's flowery language and it's abstract, I do think it's more solid actually than talking about this mystical experience that's so loose, as unpopular as that might sound. But so if we can understand the nature of the mystical experience and understand ego dissolution, then we're on firmer ground. But your question is really whether there are certain people in which you can predict that ego dissolution. I'm struggling because I don't know yet, and we haven't found anything that is predictive. I wonder whether any of the other researchers could inform on that a little better than me. I think probably the best predictor of ego dissolution is dose. And if we could go back and think about those patients whose effects haven't been as enduring, I mean, the results are incredible at 1 week, and they do endure, but we've got one patient who has relapsed. He relapsed more or less 3 or 4 weeks, and then it's frustrating, and you wonder what was it, and you do think back, and if he had experienced some kind of ego dissolution, some kind of mystical experience, whether it's framed in that way, but frame it differently, perhaps talk about, connection with others, being less self-absorbed, maybe more interested in nature and this kind of thing, maybe more present, Then if we could have given him perhaps the dose, we did all the preparation we could. Sometimes it just feels like there wasn't enough fuel, there wasn't enough juice there to get the desired effects. Our last patient in this first phase, our 12th patient, she seemed particularly very strong defenses. We gave her, both doses. The first one, she didn't feel it at all. The second one is 25 milligrams. It's a pretty high dose. She said it felt like she'd had maybe one too many drinks. And we were left there just perplexed, why she wasn't having this. The second time round, we really watched carefully that she was taking those capsules, But and then there's that really crucial question: is it that she's a fast metabolizer? Perhaps, maybe it's something peripheral or not. But maybe it's something enzymatic, or maybe it's something in that curious space between mind and body. That there was something in terms of the circular causality, which is the relationship between the mind and the brain. Whether she was doing something, in terms of psychological kind of defense. So I don't know. In terms of predictors of sort of bad trips and anxiety, again, we haven't found anything that's clearly predictive. I mean, these patients are very unwell, so you'd think that they'd, if it was, simply the basis that the more depressed and anxious you are, the more likely you are to have a bad trip. I don't really think that stands up in this case. Maybe there's something about the willingness to let go. I mean, all our prep based on how we've been mentored by the other people, our predecessors, working now and in the past, about the importance of letting go. We've certainly prepared our volunteers, our patients in the right way around that. And sometimes you have a feeling that that's crucial, but sometimes it's difficult, because it feels like you are still up against people's own will to some extent. And also it's very difficult. We often have patients saying, as the others will vouch for, I'm sure, that how do I let go, and they might want to, but it's a bit like that paradox about, yearning for enlightenment, which is paradoxical, that kind of striving. You're told to give up striving, but yet you're striving for enlightenment. What is it to let go? And sometimes you are just left thinking, well, provide the perfect conditions, we simply just need to increase the dose, perhaps. And then you wonder whether we could, in the future, identify predictors of dose response, really, where to get the dose right.